So let's talk about Botox and fillers. Botox is the most popular cosmetic procedure performed in the United States. It's primarily used to treat wrinkles in the glabella for frown lines here, the upper forehead, and the crow's feet. Botox comes as a powder and needs to be diluted. This is what the box of Botox looks like. This is what the vial looks like. This is filled with saline. Botox typically lasts approximately 4 to 6 months on average, although it may be less or more depending on the person. Risks are minimal, although you should not have it if you are pregnant. There are some minor complications you can get, such as brow ptosis or eyelid ptosis, which just means sagging of the eyelid or brow, or bruising. These are all temporary. The procedure only takes a few minutes, and results are seen starting in a few days. Most doctors charge about the same amount for Botox. If you see an ad for cheap Botox, be aware that this may mean that it is very diluted, and your result will not be as good or may not last as long. Now, fillers are used to treat wrinkles or augment areas of the face. Most commonly, fillers are used in the lower face, particularly the nasolabial folds or the lips. They can also be used to augment the cheeks or even the chin. There are various fillers on the market, each with advantages and disadvantages. The most popular at this time are Restylane, Juvederm, and Radius. Here's what a box of Radius looks like. This is what a box of Juvederm looks like. Now, Restylane and Juvederm are made of the same substance, hyaluronic acid, and typically last 4 to 6 months. Radius is made of hydroxyapatite, which is a primary component of bone. So Radius generally lasts longer, and it also fills the space a little bit more than the others when using the same volume. The procedure only takes a few minutes. Now, to know which filler is best for you, it's best to just speak to your doctor. It may depend on the area you want filled and on your doctor's experience and preference. My own preference is to use Radius for moderate to deep nasolabial folds and to fill areas such as the cheeks, chin, or jowl. To enlarge the lips or fill the tear trough, which is right under the eyelid, my preference is Juvederm. However, Juvederm does also work well in the nasolabial fold, particularly if the depth is mild to moderate in degree. Results for all fillers are seen immediately, although there will be some swelling which may take 1 to 3 days to go down. Generally, patients are very pleased with the results as long as the expectations are realistic. Now, some doctors advertise a liquid facelift, but patients should realize that the results seen with fillers are not the same as having a surgical facelift. In addition, the improvement with fillers will be gone within 6 to 12 months, so the procedure will need to be repeated. The one filler you should avoid is silicone. While it is permanent, the complications from silicone injections can be severe, and they may not occur until many years later. Best of luck to you.